Next, I'd like to introduce two of my colleagues who will be highlighting who we serve and review the program's progress and outcomes in a presentation called Winning with Data. I'd like to introduce my colleagues, Delisa Young, Senior Research Analyst with LA Best Babies Network, and Monica Charles, Data Analyst at LABBN. Please welcome them.
Great. Thank you, Charlene. Welcome. I don't think that's working. Welcome. All right, we're going to get right into it. Hence our title. Today we're going to be talking about winning with data. And throughout the presentation, we're going to be highlighting sites who are doing just that, winning with data. Just a disclaimer, if you do not see your site displayed on the screen today, that's okay. We know there are other measures that you're excelling at that we're just not going to be presenting on today. So to kick off this presentation, we are going to be highlighting Martin Luther King Jr. Hospital. They recently presented some of their quality improvement data, and they were focusing on increasing referral follow-ups. And this means the staff are going out and checking in with clients to make sure that they have accessed the referral or to check on the status of that. We know that many sites have struggled on this particular measure. And I already know what you're thinking, but the database is too slow, it didn't save my referral, etc. We know the challenges with the database. However, there are some things that your site can do to increase performance. And that's exactly what Martin Luther King Jr. Hospital has done. So their management team, they noticed they were underperforming on this measure. And in fiscal year 17-18, only 23% of referrals are being followed up on. And they noted some observations. One, there was a lack of consistent intervention and monitoring. There were issues with documentation of referrals. And also, their data analyst was transitioning out and a new one was coming in, and they're responsible for tracking that data. So how did they go from 23% follow-up to 80% in the current fiscal year? Well, a few things. They reviewed referral protocols. They also reviewed what their target should be, where they should be on that measure. And also, the parent coach supervisor got involved and began reviewing referrals with the parent coach. And also, their data analyst began checking for referrals at a particular key visit, and eventually will be checking for referrals at every visit. So the reason why we're highlighting this site is because their work here really highlights the collaborative nature of teamwork and really valuing multiple roles. And that is how you win with data, by doing it together. In addition, we know that if you're checking in with clients to see if they've accessed referrals and you're reminding them of that, the increase in them actually accessing those referrals and getting the needed services they need. So congratulations to Martin Luther King Jr. Hospital. Okay, now let's talk about prenatal enrollment. So we see across the fiscal years that we are serving over 2,000 clients every year. In fiscal year 17-18, that was our largest prenatal enrollment year. Over 2,400 clients were seen prenatally. And although there is a dip in the current fiscal year, and this data goes to May actually for the current fiscal year, so we still have a month, but yet we have noticed a decline in prenatal enrollments. But the good news is that there are multiple sites that are working on improving these numbers. They're doing quality improvement projects to address this. So we do hope to see an increase next fiscal year. So even though there was a drop this year, we do want to acknowledge the increase from fiscal year 16-17 to 17-18. And there are a few sites who we noticed increased during this period. Those sites are Maternal Child Health Access, St. Francis Medical Center, Antelope Valley Partners for Health, Martin Luther King Jr. Hospital, and Northridge Hospital Medical Center. Congratulations. Hospital enrollment. So we see here a steady increase in hospital enrollment. The current fiscal year, although we have not completed the fiscal year, there's still a month to add on to this data, but we are already above the previous fiscal year. And we attribute this to the many quality improvement projects that the hospitals have implemented. Many of them are working and focusing on increasing hospital enrollment. And we do want to acknowledge those sites who we've noticed have either increased by more than 10% from the previous fiscal year, or they are consistently above average. Those sites are Antelope Valley Partners for Health, Torrance Memorial Medical Center, Providence Holy Cross Medical Center, Providence Little Company of Mary, St. Francis Medical Center, White Memorial Medical Center, Emanate Health, and Valley Presbyterian Hospital. Congratulations. Home visitation enrollment. Okay, please do not be dismayed by the decrease. These programs have been running for multiple years, and many of these sites have reached capacity and do not have space to continue taking on more clients. And this is why the Department of Public Health and Mental Health expansion is very timely and pertinent. In spite of the decrease in home visitation enrollment, there are a few sites that have done well with their enrollment rate. They've either increased by more than 10% from the previous fiscal year, or they have consistently been above average. Those sites are Plaza Community Services, Children's Institute, Inc., Antelope Valley's Partners for Health, Child Care Resource Center, Foothill Family Services, Wellnest, the Children's Clinic, Shields for Families, The Whole Child, and LA Biomed Health Projects. Congratulations. Now Monica's going to talk more about the clients we serve.
Hi everyone, I'm going to walk you through the client's journey from giving birth at the Welcome Baby Hospital to receiving the initial hospital visit and then receiving a referral to a postpartum program. So we start off with the hospital census numbers of moms who gave birth at our partner Welcome Baby hospitals around LA County, and this number was approximately 35,000. Now, of this number of moms who were available to be approached at Welcome Baby hospitals, 71% of them were then approached by a Welcome Baby staff at the hospital. And so at the hospital, the Welcome Baby staff members are the hospital liaisons, and these hospital liaisons will meet with the mom in her hospital room, introduce Welcome Baby, and see if she's interested in the benefits of the program. If she is interested, then she'll enroll right then and there in the hospital. And of moms who were approached, 56% of them then enrolled. During the hospital visit, the hospital liaison will get to know mom, get to know her needs and her family's needs. And this is needs such as housing, social support, mental health, breastfeeding, food safety, and so on. And based on these needs, program capacity, and where mom lives, she will then receive a referral to a postpartum program. So of those who enroll at the hospital, 92% of them will then receive a referral to a postpartum program. 91% of those clients will go to Welcome Baby, and 9% will be referred to home visitation, which is Healthy Families America, or Parents as Teachers. So to better understand the referral pathway, I'm going to take a deeper dive into the client needs assessment and where mom lives to understand how this impacts the programs that she can be referred to. So based on the needs assessment, 61% of clients were found to have greater needs in fiscal year 17-18. The other factor that determines where mom can be referred to is where she lives. So First 5 LA programming focuses on families in Best Start communities. And these Best Start communities, if you don't know, are 14 geographical areas in LA County that face critical issues and also have networks that can provide support. So in the existing referral structure, moms who live in a Best Start community and have greater needs are eligible for intensive home visitation services with HFA and PAT. And this represented 17% of moms in fiscal year 17-18. 44% of those with the hospital visit had greater needs but did not live in a Best Start community. So these moms were still able to enroll in lighter touch Welcome Baby programming. So to look at this breakdown of greater needs clients on a map, I really like maps, only those clients which reside in these Best Start communities in light blue were eligible for more intensive home visitation services in fiscal year 17-18. And as Delisa mentioned, our existing HFA and PAT agencies, they're nearing capacity in serving just clients in these communities. But we have also seen across multiple fiscal years that there's a large population of greater needs families that would benefit from more intensive home visitation services. So in the darker blue, you can see that nearly 3/4 of the greater needs population enrolled at Welcome Baby hospitals resided outside of the Best Start communities. So by looking at this trend, it was really clear that it would be ideal to increase access to services, and we have been fortunate enough to partner with the Department of Mental Health and Department of Public Health to expand home visitation. And with this expansion, which started this fiscal year, all families in LA County who have greater needs are now eligible for home visitation. So we have new teams covering every service planning area in the county, and this is a huge win with data. We are really excited to see how the numbers look next year. So to paint a better picture of the moms that we serve, I also want to share some demographic information. About half of moms enrolled at the hospital in fiscal year 17-18 were 25 to 34 years old, and 1/4 of moms were 20 to 24 years old. In terms of client ethnicity, about 3/4 of the moms we serve are Latina, 10% are African American, 5% are Caucasian, and 4% are Asian. Other ethnicity categories represent less than 3% of the client population. One thing that our network noticed in analysis of enrollment rate was that African American moms are less likely to enroll than other moms. And in another win with data, the network started a work group dedicated to increasing engagement with African American moms so that African American moms and their families can benefit as much as possible from home visitation services. And this work group includes representatives from Welcome Baby, PAT, HFA, and the county, and they're already doing really, really inspiring work. I'm going to pass it back to Delisa now, and she'll talk about program impact.
Thank you. One of the many benefits of Welcome Baby and home visitation is connecting clients to needed community resources and referrals. In fiscal year 17-18, about 9,000 referrals were accessed by clients, and we believe that that number is even higher, but those referrals were just not documented. And some of those top referrals are charitable services. That includes food, diapers, clothing. Second, lactation support. Number 3, health insurance. Number 4, dental care. And number 5, WIC. So our clients are being connected to exactly what they need, and you guys are doing a great job of connecting them to those resources. Another benefit of Welcome Baby and home visitation is the implementation of screening for depression and child development, which really speaks to prevention and early intervention. Screening early for depression can prevent the negative consequences of depression, such as suicidal ideation, caregiving activities that compromise the care for the children, and also for childhood development, early identification of developmental issues can actually prevent those issues from being exacerbated and children really being impacted by those issues. If we catch it early on, we can connect clients to early intervention services. And our programs do a great job of screening for these things. For Welcome Baby, 100% of clients, for PAT, 99% of clients, and for HFA, Healthy Families America, 93% of mothers were screened for depression within the first 3 months. And for developmental screening using the Ages and Stages questionnaire, 98% of Welcome Baby clients, 86% of Parents as Teachers clients, and 77% of Healthy Families America clients received a developmental screening within the last year. So this is great for prevention and early intervention. Okay, immunization, how are we doing with that? For Welcome Baby, children who are 9 months of age, 95% of parents report that their child is up to date on immunizations. And for home visitation, children who are 12 months of age, 83% of parents report that their child is up to date on immunizations. And I think these high rates can be attributed to the work that the staff do, making sure that clients are going to the doctor regularly and helping them schedule those appointments. And speaking of doctor's visits, there is one visit that is very key for mothers. It's the 6-week postpartum checkup visit. And this is also a HEDIS measure. And HEDIS is the Health Effectiveness Data and Information Set, which is a tool that is used by 90% of America's health plans to measure performance on dimensions of care and service. And during this doctor's visit, the doctor's checking to make sure that mom is healing. They're checking on their emotional state and checking for any immediate health risks. So it's a preventive visit as well. So it's a very pertinent visit. And as we can see, each of our programs is outperforming other health plans such as Medicaid HMO, PPO, and commercial HMO. In addition, there are a few sites that are above 90% on this measure or they have improved by more than 10% from the previous fiscal year. And those sites are El Nido Family Centers, Shields for Families, Families in Good Health, Miller's Children's Hospital, Wellnest, Spirit Family Services, and the Children's Clinic. So congratulations to those sites. Now, Monica's going to close us out talking about program completion and client satisfaction.
So in looking at those who complete the program, Welcome Baby has seen a consistent increase in number of graduations per fiscal year for clients that are in the 2-month program, Welcome Baby Light, and for clients that are in the 9-month program, Welcome Baby Full. So we want to recognize the following sites, which improved by more than 10% from fiscal year 17-18 to 18-19, or which are consistently above average in completion rates. Centinela Hospital Medical Center, Antelope Valley Partners for Health, Northridge Hospital Medical Center, St. Mary Medical Center, White Memorial Medical Center, and Maternal Child Health Access, and a special recognition to Maternal Child Health Access. They increased graduation count by over 200 clients this fiscal year. And then for PAT and HFA, because programs are longer term, we're only just starting to see clients graduate, but we have seen an increase this fiscal year, and we want to applaud home visitors and clients, because maintaining engagement for 3 to 5 years is very impressive. And lastly, I want to highlight some of the results of the Welcome Baby Client Survey from fiscal year 17-18. In a score out of 5, clients responded an average of 4.8 when ranking their confidence as a parent. And when ranking satisfaction with the program overall, clients responded with an average of 3.9 out of 5. I'm sorry, 4.9 out of 5. Shouldn't misspeak on that one. So this speaks to all the work we do. It's beyond the numbers. It speaks to collaboration between everyone here, Welcome Baby, PAT, HFA, the county, everyone, all of our programs. Every effort made is leading to our clients' success and empowerment, and that's what we are all here for. And that concludes our presentation. Thank you so much.
Another round of applause for Delisa and Monica, please. All right, next I'd like to invite Dr. Deb Darrow for her presentation, Crafting Child-Centered Communities, the Role of Home Visiting. Dr. Darrow has played a key role in the development and assessment of evidence-based home visitation programs for the past 30 years and has worked with federal administrators and congressional leaders in crafting guidelines for McVie, passed as a part of the Affordable Care Act in 2010. Notably, Dr. Darrow contributed to the development of Healthy Families America, one of the 12 evidence-based national home visiting models supported under McVie. Dr. Darrow, please welcome to the stage.
Okay, great. Thank you, and thank you all for inviting me to share some comments with you today. You know, I've been working with First Five for 10 years, thinking about the idea of how you would really build a home visiting system. And I have been so impressed with everyone I've worked with, not just the First Five staff, but every program person I've met, every state agency person I've met, every person that has really stood up and said, every service provider, that has stood up and said, we want to make a difference. And we've decided that we're going to devote ourselves to improving home visiting. But you know, the numbers that you just saw are important, they're impressive, but I want to invite you to think about what home visiting can do the next step. What could you do to create a context that would be more hospitable, not only for families, but hospitable to the programs that you're providing? So today I'm going to talk about how important home visiting is. It's definitely a powerful strategy. It's a strategy we've learned more about, and some of you may see sometimes it works, sometimes it doesn't work quite as well as we'd hoped. We could be disappointed by those findings, but I still think home visiting remains the best bet we have to improve outcomes for families and children. But we also know that it's beyond replicating models, it's beyond program slots, that if we want to provide an effective level of support for all families, we need to think not just replicating programs, but building systems that can be effective in changing the context in which we all work and live. And we need to learn that we all have to share responsibility for enhancing the parenting context in creating child-centered environments. It's not something we do alone. It's not something that I'm doing it so I don't have to worry if my neighbor does it. It's something that we all have to own and be responsible, not only for the children we birth and the children we serve, but for the children in which we live with in our neighborhood. So how can we build a better system? How can we start thinking differently about the context of supporting families and children? I think first we have to reject this notion that only some children and their parents need collective assistance. The idea that parents can just do it on their own if they've got gumption, and only the failure people need help. The truth of the matter is, we all need help. We all know that raising children is a tough job, and no one gets a pass. No one finds it easy. Or if you found it easy, see me afterwards and tell me how I could have done it better. We need to embrace this dual commitment to supporting parents and enriching communities. And we need to, I think, begin to link the fragmented systems of our child protection services and our prevention services together in a way that can meet the needs of all children. You know, they say that the way you define child protection in this country is really balancing three values: how we value parental autonomy, what we think about with respect to child safety, and what we think about with respect to child development. In this country, what we've decided to do is wait to help families until they fail, quite honestly. That's the mandated service. If you fail, we've got a child protection system for you. But up until the point of which you fail, well, prevention is just there if you've got the gumption and can find it. It would be a little bit like going to the doctor and you have sort of little precancerous cells. And the doctor doesn't give you chemotherapy. He doesn't send you to intensive therapy. But he doesn't send you away and say, come back to me when you've got stage 4 cancer, and then I'll help you. I have some really good therapies. The health department has figured out that there's a very link between what we do with prevention and what we do in really addressing disease. In child protection, we've had 2 fragmented systems, and what we need to begin to think of building is a coordinated system, and will be most effective at both the prevention and the intervention end if we build on a universal platform that assesses the capacity of all parents, offering each of them the level of service and assistance they need at the time that is appropriate. Here in LA, you're real pioneers, you're innovators, and you're leaders in showing the country how to do this, how to begin to meld a prevention and a child protection system. So I want to spend a little time talking with you about why I think that's effective and why it's important. The key factor you have here is you've built a universal platform. You're moving towards every year extending your universal reach. That map that was up here, where you were working in few communities and now you're county-wide, that's what's most impressive. You're saying to families that no matter where you live, no matter what your circumstances are, we believe you could benefit from initial help. We believe that someone should talk to you at the time you have your baby and show that they care about the outcome. And that's the system you're building. And I think the benefit of the universal system, the approach, is at least fourfold. First, it does galvanize individual needs into a coordinated system. It builds a service delivery structure that galvanizes individual choices and interests into a collective call for action. It's not that one family wants a service or one program wants to do it. You're saying we collectively get it and we want to provide it together. I think it elevates the parent or consumer voice as to what exactly we need. People like me go around the country. They call us thought leaders. Sometimes they call us stupid idiots, but I like to think thought leaders is a better phrase. But they go to people with, quote, education, quote, background, quote, experience, and say, what do you think families need? And we come up with ideas. And then people go and do them. But you know what? We don't spend enough time talking to families and saying, what do you need? Listening to their response and collectively learning from what they're telling us. The universal system you're building now, by sending your workers out into this county every day, every month, you go out and you ask families what do they need, and you bring those needs back. It's a way of helping communities, I think, realign their resources. So they're providing the services not to what I think should happen, not to what I think some research guru thinks should happen or some politician thinks should happen. It's designed to meet the needs of individual families. I think also when you do a universal platform, you create the context in which all children are viewed as appropriate beneficiaries of our collective action. It really creates this notion, as I said, that it's not the families over here that can't manage and the families over here that are fortunate enough to do it on their own. It recognizes that we all get help. We get help from somebody. Sometimes it's a public agency, sometimes it's our relatives. I like to say I had 2 home visitors when I raised my children. One was a nurse, one was a paraprofessional. My sister was the nurse, my mother-in-law was the paraprofessional. And they were wonderful, and they taught me not just how to care for my baby, but how to love my baby, how to enjoy being a parent, which is probably one of the greatest gifts you're giving. And maybe that's one of the outcomes you should begin to measure. Finally, what I've been impressed with, people that have done universal service or when home visiting is widely effective, that's where you get your workforce. I was in a meeting with leaders from Parents as Teachers recently, and every one of their major national profile people talked about why they were working at PAT, and every one of them said, you know, when I was a new parent, PAT came to my home. I had a PAT home visitor, and I remembered as I went to develop my career how good it felt to have somebody come in and ask me, how's it going with your baby? And so we generate a sense of career and interest in what we do by providing those services to all newborns and their parents. When we talk about universal and you look at this picture and it's obvious what the problem is, if you give everyone the same service universally, you give some too much and some too little. What we really talk about in this venue is really targeted universalism. We give people what they need. We give the level of service. And that's the system you have set up here in Los Angeles that is so effective. It's really a two-tiered system. There was a little handout that's in your book that I recently, in your little packet, that I did for the Society on Research and Child Development recently, where we really said this idea of preventing child abuse really requires both a universal reach to all parents and then targeted services to those that need the most help. It really does not just make sense for families, but I think begins to unearth this a political platform generating public commitment to the idea of supporting newborns and their parents. If we believe that learning begins at birth, why do we start funding schools for kids when they're 5 years old? Why is that 5 years some sort of magical point in life where we really should begin to think about providing the resources to children, all children, at the point that they're born so that they have the opportunities they need? So going forward, the job is one in which no one can do it on their own. We're here celebrating your work. We're celebrating the work of the home visitors and their directors and their managers and their funders. But in truth, it requires everybody. Everybody has a role to play, and we need to help each other to get up the mountain. So then I asked myself, if we all understand how important it is to work together, why is it that we don't work together? Why do we stay in our silos? Well, I think in some ways we lack a perception that we have a common consensus. And this is what the power of the supervisor's statement was. If it did nothing else, it gave all those agencies in the county and all of you that work in this field some common mission. You co-created something that was bigger than any individual entity. If you don't do that, I think it does allow us to stay in our silos. We do believe that life is a zero-sum game. We constantly operate from a perception of deficits as opposed to a perception of abundance. There's a lot of resources. We need to devote those resources and direct them in a way that's most effective. Yeah, there's competition for funding, and all of you that are community-based agencies know that you do sometimes have to go forward and make the best case for you because you need money to survive. That's fine, but our collective mission should be raising the platform so that there's resources for everyone to do the job. We are more comfortable singing to the choir. We like to stay in our tribe. We like to stay where we have some degree of expertise. It is threatening to go and talk to somebody that differs from yourself. But you know, if you don't ever go out and talk to somebody who differs from your opinion, I don't know how you learn. How do you grow? How do you go forward? And then finally, I think the pragmatic issue is it is faster to do it yourself. Anybody ever serve on a committee at church or in a community agency? And you often say, you know, I'll just do it. I'll just buy it. And we have to overcome that sense that because it's faster when we do it ourselves, doesn't mean that it's better. Doesn't mean that you're going to get the best bang for your buck. It means that you just have to overcome that and learn to work with your colleagues. So as we're building common ground, I'd like you to think about at least 3 attributes that I think we need to enter all interactions with. First is that of humility. Every time you go into a room, don't think you're the smartest person there. You're doomed to failure. There will be someone smarter, I guarantee it. Your information is not perfect. You don't have all the answers, and you should be concerned about finding the answers you don't have. The quality of gentleness, I love that term. It's a term that in my mind says you put yourself in the other guy's skin. You say to yourself, brother, I wonder why they think that. I wonder why they're acting that way. What is it about their reality that is forcing them to be so unreasonable? Because I'm clearly the reasonable one here. But the idea of keeping those judgments to yourself and listening to those you're interacting with. And then finally, the virtue of patience. Patience is a hard thing. I used to have a nun that said, patience is a virtue for those who possess it. It's a very difficult thing, but you have to say, you know, I don't change on a dime. I hold fast to the ideas I believe. So when you're trying to work in collaboration, you need to give the other guy a little bit of chance to see the errors of their ways and agree with you. Only kidding, you should sometimes agree with them. So when I think of this, one idea that I've been playing around with recently is thinking about, wonder if we took our values and our relationships, not just our knowledge, but the way we think people should interact it that way in our work with our colleagues, our families, our coworkers, and what would it look like? And I've thought of thinking about modeling a wise community as a framework that we might want kids to see as they grow up. We tell kids a lot of what to do and how to act, but wonder if children really observed those values in action. Wonder if every time you worked with colleagues, every time you worked with other agencies in your sphere, every time you had interactions with parents and parent groups, what if we approached it with the idea of modeling a wise community? What would that look like? Well, first, we would do the task together. We would recognize the collective responsibility we have to all our children, both those we birth and those we come in contact with. Second, we would be dedicated to a set of values and practice what we preach. We would show children how to act, how to respect each other, how to show tolerance, how to share responsibility for the future we want them to have. We would keep our commitments if we promise something to anybody, whether it's a client, whether it's a colleague, whether it's an agency, a public staff person. We would do it even if it interfered with our own immediate self-interest. Because we made a commitment, we would keep those promises. We would be humble. We would admit when we were wrong or we made a mistake. We would understand that just because we're older, just because we're the adult in the room, just because we have more experience, doesn't mean we may not do something really stupid. Age and experience is no guarantee of wisdom. It's no guarantee of wisdom. And I have been in many settings where people they think that tenure is a sign of success. Not necessarily, not necessarily. And we would be disciplined, and we'd understand the need for boundaries and rules. We'll not assume that we're above the rules in our work, or that parents can manage on their own to find their own path without some guidance. We will help people self-correct, not by beating them, which is a horrible analogy, or humiliating them, but by firmly guiding them onto the right path. We will show compassion if they go off the path, but we'll help them recenter on what matters. Finally, I think we'll be open to all of us to being parented ourselves, to listening and learning, to recognize the interconnection that makes us social beings. Sure, we can be independent and responsible for our lives, but wise communities require that few of us, and recognize that few of us, achieve things on our own. All of us have needed help, and most of us have gotten that help when we've reached for our dreams. And when our dreams and hopes were not realized, there's great comfort in knowing that there are people there that will pick you up and will say, it's okay, I'll help you recover. So as I look to the future, I love this slide I developed a few years ago. I have no idea what this means, and I have no idea how to link the pieces together. I've never gotten any further than putting up the pieces. But you know what? I'm comfortable with the pieces, because I think in some ways this is our challenge, to constantly remember the different components we want to put together, think of it as a puzzle, and begin to put the pieces in a way that makes the most sense, that tells the best story. You know, Archbishop Oscar Romero at San Salvador during the Civil War in El Salvador was asked by his congregation, why are we not making progress? We work so hard, but we never see change. Society stays the same. And he told them that, quote, it helps now and then to step back and to take a long view. We cannot do everything, and there is a sense of liberation in realizing that. It enables us to do something and to do it very well. We may never see the end results, but that's the difference between a master builder and the workers. We are workers, not master builders. We are prophets of a future not our own. It got me thinking about, what is a prophet? Is a prophet somebody that's kind of in their mind, they see things, they're clairvoyant, they understand the future, and that somehow that's their big contribution? Or is a prophet someone who has a sense of a future and shares that future with everyone they interact with? And that by sharing that future, they empower people to begin to live the way the prophet or vision would suggest we should live. In that sense, we're all part of system change. I don't know what big agency managers discuss at their tables. I've never run a big agency. I don't know if that's good or bad. But the truth of the matter is, I do know a little bit about relationships and how people work together. And it's my sense that when people start working together, when people start sharing their image of what they hope to realize, It's in that sharing that we begin to see possibilities for moving forward and creating not just programs, but a system and a context in which parents do well, children are nourished, and you know what? The work you do has a much higher likelihood of success. Thank you.
Thank you so much, Dr. Darrow. Before we break for our break, we have 2 raffles and a Mentimeter. So let's go back to the Mentimeter slides. Take out your phone. And here's your question. What am I grateful for that I've learned about myself for the past year? So it's a word cloud. You have up to 3 responses. Actually, it might just be a text box, so you might have more room. Yes. It's a text box, so you can type as much as you want. Just in case you need to get back onto menti.com, and the code is 806384. I am resilient, humility, patience. I am safe. I'm not perfect, but I'm good enough. I'm resilient, family, worth. I want to be happy, my daughter, gratitude, patience. Lots of resilience up here. Inner healing. I can do it. Gratitude, self-care, brave. I am stronger than I thought. My faith will take me anywhere, motherhood, capacity to grow. The ability to move on. We are going to take a 15-minute break. We expect everyone back here no later than 11 o'clock. Thank you so much.